Hey guys, welcome to another episode of No Mama Grow Mama. This is the place where we talk about all things related to health and wellness for you and for your whole family, which is pretty much going to be every single topic under the sun. We're joined again today, this week, by Dr. Ana Freire. Dr. Ana, if you've seen previous episodes that we've done, is a naturopathic doctor. To me, she is a hero. If you have ever seen the episodes before, Dr. Ana comes with an incredible skill set that to me really sets her apart and above in the world of healing. So Dr. Ana started as a traditional medical doctor, and she found that it didn't really resonate with how she wanted to provide care for her clients. And so she actually switched and went and did her training to become a naturopathic doctor. So to me, that's really cool because she has an abundance of knowledge from sort of both sides, traditional medicine and naturopathic holistic healing. So today, Dr. Ana, we are going to be talking about what we're going to call hyperactive children. Mm-hmm. I think what I need for you to do for me especially is, to me, that is a really hot button topic. It's a big topic. It's probably also an inflammatory topic. I know in my own world, there are children in my life that I would say are probably hyperactive, though I bet their parents don't want them to be classified as that. Can we talk a little bit about, like, is there a scale of hyperactivity where we say this is normal in children versus this is sort of on the, we need to examine this side? Can we start with that first?
Of course. Yeah. So, okay. First of all, thank you for that lovely introduction. I feel, I think I'm blushing. So I definitely appreciate that and the vote of confidence. Really, it's a great opportunity that you've granted me really to be on here and to speak with your demographic, your population. I do love to talk, as you will all learn, and really just empower everyone with information to make their best choices in health and otherwise. So moving on into the topic of the day. So is there a spectrum? So what happens is really there is a like diagnostic criteria, we'd say, that you need to really diagnose a child with a disorder, and we're all talking about attention and deficit hyperactivity disorder, ADHD, right? And when it comes to labeling children, that can be problematic for parents, for the child. At school, it's easy to just like, oh, that child has ADHD, and it's just a no-win situation. So before we need to ascertain that there are certain diagnostic criteria that child meets. And so usually the child can be evaluated by a mental health professional. But before we even get to that point, going back to the conversation of, is this normal? What do I expect? We can tie it into a previous conversation we might have had on here, which is like trusting your gut. So first, as a parent, you might know what has been normal for your child, or in this child up to a certain point. So has the behavior changed all of a sudden? That's another important clue. And in comparison to the other children, perhaps in the household, even though every child has their own personality, right? They won't just be all acting the same or talking the same way, but is there such a gap in the way this child behaves or responds to certain stimuluses? So that's usually where we start. And so if the parent has a concern that this may or may not be within the realm of normality, then that's when we have a discussion. And usually that point is when it hinders that child from progress or success, be it in their developmental stages, be it at school. And usually that's where that line is drawn. So if this is having an impact on their ability to perform and function on a daily basis, then that's usually when, we have our thinking caps on to see if this is hyperactivity. Is it within the range of normality? Is it ADHD, for example? But most importantly also, could it be something else that's presenting as ADHD? Because there are other things that could mimic. So let's not jump the gun.
Right, right. And I mean, that's why I wanted to do this topic specifically today, because I think it is a big topic. And I think there is sort of a broad spectrum of if it's actually ADHD or if there are things that are at play. So let's talk about that then. What are some other things that could be at play that don't necessarily mean that your child is going to end up with a diagnosis of ADHD?
Mm-hmm.
You know what? Let's back that up first. Before we even get to that, let's talk about specific things that we're looking for in a child who is quote unquote hyperactive. If I was a parent, and maybe I don't have much information on this, maybe it's my first and only child,
Mm-hmm.
have other children, maybe I don't have siblings who have children. This is just my own child, and I'm not sure what a hyperactive child looks like. Can you sort of break down for us, if a parent were to take a step back,
Mm-hmm.
look at their child, trying to determine if their child is a hyperactive child? Maybe there's been some things at school that have been said, and we're just really trying to determine whether or not there is merit to this. What does an hyperactive child's behaviors or days kind of look like?
Okay, so notoriously, children with hyperactivity, and this is not just hyperactive, but with ADHD, they usually have like disturbed sleep patterns. So usually sleep is a big issue in the household, and that can be true for many children, but sleep in particular, not being able to unwind at the end of the day and then being able to actually fall asleep in a relatively regular manner, it could be a clue. But most importantly also, when we're talking about hyperactivity or the symptoms of hyperactivity in children, we're talking about things like kids that are like constantly fidgeting or squirming. And so it's okay, obviously, if we're asking for a 5-year-old child to sit down at the dinner table for 40 minutes and not move, for them to be squirmy, right? But if we're talking about like everyday tasks, 5 or 10 minutes, they can't just seem to sit and maybe take out their work without kind of touching everything and fidgeting around or shaking their leg or tapping their fingers. So that goes also into a difficulty with like sitting still, having quiet playtime, or just relaxing. Maybe watching a family movie, being able to just be still. And it's also a child that has like this constant need to move. So running, climbing, and in inappropriate times, right? So if the child is playing and they're out in the park or even at home, that's construed as normal. But if everyone's kind of settled and they are just rampant through the house without being able to take a moment to sit, that's also something that we see in hyperactive children. In addition to then also talking excessively. So a child that just won't be quiet for, if it's 30 seconds, or they're always chattering on about something, oftentimes interrupting others, or kind of coming in, bulldozing a conversation. And then in certain other children as well with hyperactive symptoms, you might even see symptoms of like outbursts or having that quick temper, that short fuse, can also be signs of hyperactivity. So those would be the big things to look out for.
Okay, that's awesome. So going back to what we kind of chatted about before, you had mentioned that there could be other, would the best way to describe it be conditions or influences or other things that can impact the activity level in a child that may not necessarily mean that someone's child has hyperactivity disorder. Can we talk about that a little bit? What would those things?
Yes.
I mean, I can think of one off the top of my head. Parents, you and I both know, sugar.
Yes.
With my own kids, we had established a long time ago, food dyes.
Mm-hmm.
Food dyes make them go crazy. can we talk a little bit about that, especially if parents, maybe this is the first time that they're hearing something like this. Can we talk a little bit about what are some of those other influences or symptoms, those kinds of things that can impact this as well?
Exactly. Perfect, Jennifer. So you hit the nail on the head on that. So a diet, definitely. And this also speaks true in that line of the same thing that's causing it. If it's just a child that's being more active than you would consider as normal, a diet, sleep, and exercise are kind of like the pillars. So if we're having a lack in any of those areas, so in diet, be it through the addition of like additional sugars and dyes, lack of exercise, or lack of sleep, they can then all have consequences in the way the child is able to perform. And I think even if we take a step back and think, when we're on our days that we're hyped up on caffeine, probably had a couple of donuts, didn't sleep the night before, and are just overall taxed without being able to move, and we've just been sitting at our desk all day, we feel that, and even as I say it, I'm having that physical reaction of like, we feel like we're pent up. And then as a child, obviously we don't really think to hold that back. Everything's just, then we kind of like explode outward, right? So it's the same reaction that a child will feel if those areas of their life could use some help. The things, and those are easy fixes in the sense that it won't take, like a brain surgeon to follow it, but it's very difficult to change our lifestyle habits. So even though they're simple ideas, they're the things that give us the most difficulty in changing, but it's doable. And usually they don't construe anything medically worrisome. It's things that we can work with time. Now, there are other medical conditions that might warrant other kinds of evaluations that can also present with hyperactivity or other symptoms of ADHD children, which I know we're concentrating on hyperactivity in particular. But when we're talking about ADHD in general, that also includes children that are inattentive. So perhaps they're not hyperactive, but they just always seem like they're in the clouds, kind of dazed off. They can't really concentrate on anything. So maybe they're not jumping off the walls, but they're not being necessarily what we construe as productive or being able to keep up. Or they're very impulsive. So there are children that just do things almost without thinking. When they're doing their homework, they kind of just guess. They don't really care to sit down and figure out that math problem. It's just like they want to get it over with. But that aside, when we want to make an accurate diagnosis of ADHD, we want to rule out a few things first, if that might even be at play. And so some of those things are other learning disabilities. There are children that have problems with like reading or writing or motor skills that make those things difficult, or language that's hindering them. And that can also leave them feeling irritable, not able to concentrate, because usually that's where a lot of parents are preoccupied, when their child is not doing as well or thriving at school. And major life events as well. So if there's been a particularly big move, a traumatic experience, even bullying, these might be outward signs of that behavior. And then other behavioral and psychological concerns like anxiety, attachment disorder, depression even can present in this manner. And then truly physiological conditions, like things like problems with their thyroid, or neurological problems like epilepsy, like when a child has like absence seizures, or sleep disorders, as we've talked. So there's a slew of things that your healthcare professionals should really start investigating if they think, okay, ADHD might be something we need to look at. But let's rule these things out first if it's appropriate with what the child is presenting before we go any further.
So in my world, one of the big things that presents in our family is food intolerances and food sensitivities. Can food intolerances and food sensitivities, and maybe we can talk about, in case nobody's ever, watched, this is the first episode they've watched, maybe they're not sure what a food intolerance or food sensitivity is. Can we define that a little bit? And can that lead to hyperactive child? Could that lead to sort of a bad reaction, I guess, to that food if they have an intolerance? Is that something that's possible?
So when we discuss a diet, you'll find that a lot of the associations, a lot of like the conventional associations when they discuss ADHD, um, they won't necessarily often recognize that there might be a link with food, other than obviously a lot of like the high sugar foods, right, that are just going to be more of a stimulant regardless. But in terms of food intolerances or sensitivities, or food additives like the dyes you were discussing, sometimes aren't recognized across the board. But when we have this conversation in terms of the whole person and analyzing kind of like root cause, what might be contributing to this issue, food and diet definitely play an important role. And this is because even though, how should I word this? There isn't a link, like a cause and effect. So just because your child might have a food intolerance, that's quite a possibility, that in itself is not going to make a child have ADHD. The question here is, can it impact it, influence it, aggravate the symptoms? Then a resounding yes. So if there is a particular food that this child is intolerant to, that then has more of a systemic effect. So when we're talking about food intolerances, it's obviously usually, again, we kind of have to backtrack because this is what happens with naturopathic medicine. We kind of delve deep and then we go a little deeper. So then to talk about food intolerances, we might talk about gut health. So then when we're talking about gut health, that brings us back again to diet and what's happening. But essentially, if our system, in particular our digestive system, isn't up to par, so it's not being the best gatekeeper, and you're eating certain foods that for you, you and the child, is creating more of a systematic reaction in our body, so creating inflammation. This will then have an impact on how they're feeling physically and mentally, and we know that there's a huge gut-brain connection. And it's been studied a lot in other conditions such as anxiety and depression. So it shouldn't be too much of a stretch to imagine that should our gut be impacted in any way from a food intolerance, food additive, that then psychologically, neurologically, physiologically, these are going to have consequences in anyone, let alone a child that's already dealing with like an underlying hyperactivity or behavioral disorder, for example. The one thing that I will say is that like an assessment, when we're doing any kind of assessment, be ADHD, hyperactivity, a treatment plan usually involves identifying if there are any food sensitivity triggers so that we can help pinpoint and avoid these foods. And they shouldn't be avoided, depending on what they are, forever. But if we allow the child some time where we eliminate these foods and then we can reintroduce those, you will see that there's definitely a change in behavior. And I've seen it in clinic. And just recently, I had one of our patients that we've kind of done some similar work in terms of diet. And this was a beneficial outcome, so to speak. We were working on something else. But then they commented like, oh, I can't believe that it had such a huge impact on just like their behavior and their well-being at the end of the day. So there's definitely, without question, a link to diet and behavioral issues. Right. So not necessarily they won't cause these behavioral issues, but they'll definitely worsen or ameliorate depending on how we're using diet.
Right. Okay, so let's say a parent is watching this and they have wondered in their head whether their child maybe has a struggle with hyperactivity, or maybe, the school has said something or the daycare said something. Help parents understand. I think I've seen in my world the desire by some to ignore it and hope it goes away. Mm-hmm. They're just in a stage and they'll outgrow this, or they had a lot of Easter candy on the weekend, the sugar. Help parents understand what happens and how the child's future can be impacted if it is actually a condition and it doesn't get looked at. Can you help us understand what that might look like for that child, or what that child is experiencing specifically during those periods?
Okay, so the thing is that this, like ADHD in particular, if we're talking like straight up diagnosis, will affect approximately, like I believe, 5% of population and children. However, it isn't one of those things that you outgrow. A majority, so of those 5%, 4% will continue on to adulthood with ADHD. So these children, you know, they're resilient, they're very creative. So they have a lot to offer, but it's very difficult for them to express themselves and to be able to meet a lot of standardized testing and conditions that are set forth in an educational system. That is not necessarily catered to children that behave outside of that scope. And I know now with like school and classroom sizes, that's difficult for a teacher or teacher's aide to kind of be able to give that attention to that child and make sure, you know, they're being accompanied. And so it can be very hard for a child to go through the school system, you know, depending on, you know, the different counselors they might encounter at school, the different teachers, the different classmates that they might have, to be able to thrive and not essentially give up on education, because it can be that everyday battle. If you're looking at a child that really does have difficulty either with their attention span, like the inattention aspect, so they space out a lot of times in class and they daydream, and so they're not actively participating or learning, or if they're in a phase where they're having those hyperactive behavioral tendencies where they can't concentrate on a task for a long period of time, you can see then it's going to be difficult for them to acquire the information at school and then come home, do the homework, do the assignments, and then sit down and take testing. That can be an hour long, and then as they become older and go through other avenues of education, might be 2 or 3 hours. And so if you don't provide your child with kind of like, was I like say, like that fighting chance of having accompaniment, be it, you know, medical, behavioral, there's a number of healthcare professionals out there that they can help, and other trained professionals in counseling, educational assistance, then it will always be a struggle unless that child comes upon something that they truly excel at, perhaps in a creative field or a place where they can organize their own schedule and do only the things that they excel at. It will be difficult to succeed until they're able to really call their own shots. And even then it's difficult because they'll come from a past of always feeling as though they're doing less than in comparison to their other classmates or colleagues. And that can be detrimental to mental health. And then that's the other perspective that comes in with the children with ADHD in particular, is other mental health issues, like depression or anxiety, or the inability to even make and sustain friendships. So you can see that's a snowball effect in terms of how they'll be able to function and have a sense of well-being in early adulthood and into adulthood as well.
I'm so glad you brought that up, and I can totally relate to that. So for those who know me personally, who might be watching this, they will know this story already. But for those who don't know, early intervention, the significance of it is something I think, especially as someone who is, well, I tell everybody I'm 27, but I'm a little older than that, slightly. I think back when my husband and I were growing up, we got together in high school, so we've been together for a very long time. The information wasn't as plentiful as it is now. And my husband, when he was in school, very incredibly smart, never applied himself, like genius level material, but never applied himself, just barely got by, was tested when he was younger, and the teacher said, there's something not right here. This kid is incredibly smart, not applying himself. He was tested when he was younger, but nothing was ever done. His family never did anything to support him. We got together in high school, and we joke now that the only reason he actually graduated high school was because I helped him with one final assignment. I did it for him because he was going to fail that class, and we had plans. We were moving out, going away to college together. And I was like, no, you're not messing with my plans. I will do the assignment for you. I did it. And that's how he got to leave high school. And in hindsight now, we can see so many different things. As an adult, he has been tested and he had ADD. Before we had children, it was very manageable. We were going to the gym every day. We lived in Toronto, so we were biking everywhere. It was very easy to manage his ADD then, so much that we thought it was gone. Till later on in life, you have children, you slow down, you get a job where you're sitting all the time. And wow, a few years ago, he was hit with a massive cycle of ADD and depression and ADD and depression. So his ADD got worse, which means he was never able to function and finish anything, which made him even more depressed. And then when he was more depressed, he still couldn't finish anything. And he got into this massive cycle. And as a woman and wife trying to support him, like that was probably one of the hardest periods of our lives. And it's, we sort of look back on all that now and think, I wish I had more information.
Yes.
He had to have figured out coping techniques and things to help him when he was younger, because we might have been able to mitigate some of this stuff. So I'm glad you brought up those other things that can impact with hyperactivity. And yes, we're talking about children, but this is, like you said, a lifelong thing. And I will tell you firsthand, it will come back, and it's nasty when you're older, for sure. So, families hearing this, we all know knowledge is power, but it's a scary thing to think there's something wrong with your child. And it's even more scary to figure out what to do about it and what steps to take, how to fix it. So if a parent thinks that their child might fall under this hyperactivity sort of spectrum, what is the first thing they're going to do?
Okay, well, I would advise to seek out your trusted healthcare professional. So be it your family physician, going to speak to your naturopath, your nurse practitioner, and just lay out what you are experiencing, what your child is experiencing, and come up with a game plan of, okay, how are we going to evaluate this so my child can get the best care, the sooner the better. And then take each step at a time without becoming overwhelming. So you're already on that path to helping your child. So I know sometimes it might feel like things just aren't moving fast enough, but you're on that path. So sooner or later, there's going to be that light at the end of the tunnel, so to speak. And what I would suggest, or at least how I follow through in terms of investigating, is, okay, from my end as a naturopath, let's try to rule out if there's any other of those underlying conditions that we could potentially start to treat if needed, or to rule out completely. So things that we can see through blood work, through assessment of mental health questionnaires, and evaluating the child from that perspective. Now, if you find that, okay, this is looking as though it's more of like a behavioral issue, or there's other learning disabilities, and that's a time when you can refer out to like colleagues, or your family physician can refer out to other specialists that can then do the appropriate evaluation for whatever condition we're expecting. Now, if at the end of the day, once you have maybe that official diagnosis and you know what you're dealing with, that is a great time then to, again, bring back your naturopath on board to help with a lot of the underlying things that you need to put into play to really have a successful form of treatment. So I know when we're talking about ADHD in particular, there's that big question of like, oh, does my child need medication?
That's my next question.
Okay, so essentially what it's very much a personal choice, I find. So I don't comment one way or another whether my patients feel as though their child should or shouldn't be medicated. And that's definitely, and again, we're talking about pharmaceuticals and synthetic medication, so it's out of my scope to really advise one way or another. But I do think and believe quite firmly, and I think a lot, if not all professionals think the same way, it is not the end-all be-all of treatment. So regardless if your child is medicated, regardless if you choose to medicate your child or not, there needs to be other work being done in the background. Medication will not be kind of the savior in this case. It can definitely be beneficial. Some children, it may not be beneficial. Again, each child is individual and they will react differently to these medications. But the one thing is that, appropriate and effective treatment includes education, behavior therapy, support at home and at school, and then all the lifestyle modifications or tweaks that we can make in terms of diet, exercise, sleep.
Right. So that really leads me into my next and probably final question for you with this.
Yeah.
So I think as parents, we all, exactly what you just said, dread that conversation of, oh, my child's going to have to go on medication and he's going to be zonked out, right? Because I think that's, growing up, that's what we heard about ADD. They put you on that medication. I'm not going to say, but we all know what that medication was back then. They put you on that medication and you become a zombie, right? And that's what every parent fears for their child. So we know that medication options exist. Let's talk about the other side. If we don't want to necessarily medicate our child, what can we do from a natural and holistic standpoint instead of choosing medication? Talk to me a bit about that.
Okay. Well, and because we're talking about treatment, we're talking about family, obviously this involves a family dynamic, right? The caregivers, be it mom, dad, whomever, or grandparents, whoever is really in the home taking care of the child or the children, first and foremost, don't forget about yourselves, right? So it's easy, especially, as a parent, priorities your child, especially if they're going through something that you feel, is difficult or concerning. All attention, right, is honed on the child. But really, and I know this is a cliche, right, but you need to take care of yourself so you can better take care of your child, right? So again, small note to eating right, exercising, being on top of sleep, and also finding ways to reduce your own stress and seek support. Maybe it's from friends, family, other groups of parents that maybe are experiencing the same things. Okay, now having said that and focusing specifically on the child, first speaking in general to environment. So if we are working with a child with ADHD, hyperactivity, or otherwise, environment is quite important. So establishing some form of structure and sticking to it will be very important for your child to feel secure and also allow them to be focused and organized. So that comes through with implementing daily routines and, oddly enough, simplifying your child's schedule. Sometimes we're okay, this child's hyperactive, so let's give them many activities to keep them busy, right? Because idle time just gives them more reason for them to kind of go and do their own thing. However, it has to be moderated. You need to understand how much your child can do without it being more overwhelming than helping. So that's just a point that I want to clarify, because we have to imagine it, if you want to think of it in the sense of how do we feel when we have an insurmountable task or tasks to do. We usually don't thrive. We start feeling like that chicken with its head cut off, okay, we're on this call and then we're doing this, and it gives us this anxiety.
Or I just want to go to my bed and curl up under my duvet.
Yes.
And go away.
Yeah, we're just, okay, I'm done. I'm not going to do anything, actually. I'm just going to crawl away. And that's the same with any child. Maybe some children are more resilient. They thrive on that. But for a child with any trait of hyperactivity, that can be too overwhelming, and it's going to make them feel more wound up. What we need to do is introduce activities that are healthy, that they enjoy, to keep them occupied but not bombarded. So it's like when we have a simple list of things that they know they can do next without overwhelming the schedule is going to be key. And that's going to, again, differ based on your child, but just keeping in mind not to throw too much at them, trying to kind of occupy all of their time. It'll work against you. And then the other thing that many children thrive on, children with hyperactivity in particular, is setting clear expectations. So trying to make a home environment, and this again can also be carried over into school, but in the home is where we can kind of control more of that environment, is, making rules of behavior simple and really explaining to your child like what will happen, or what are the consequences or rewards of following through with certain behaviors versus others. And this, there are days when that'll be kind of like a battle, right? It sounds very easy. I'm like, okay, so I set schedules and I have, right? But any child will test your boundaries, and a child with that is dealing with hyperactivity will find it even harder to kind of go by that set of guidelines. So consistency, being consistent, and introducing then tools that might help you do that for your child. So using clocks or timers, so they have a set period of time when they're asked or tasked to do something, when they know they need to be out of bed by or go to bed by, and it's something they can rely on, so they can carry over into young adulthood, right? You're not going to be waking up your child when they're 16 or 17 all the time, right? So it's also empowering them with feeling as though they also have some control with what's happening, because you want them to feel that they're not just being talked to or told, okay, now you have to do this. They need to feel also that they're active participants in what's happening. And this will go beyond the hyperactivity. And then just the environment in the home. So setting that quiet environment where there's not a lot of other distractions or noise or other kids kind of going in and around and jumping. Obviously playtime is playtime, but when we're working with homework, or we're working on other tasks that we want them to be able to follow through with, these are the things that we like to see happen. Sometimes it's hard, but with time and with effort on everyone's part, so it has to kind of be like a team to really put this through into action, it is possible to create that semblance of routine, which will be comforting to the child. Now, there are like the other three pillars, which are the things that we talk about most when you go in to see a naturopath, for example. So exercise, sleep, and diet. You can't get away from it, right? So anything that comes up, usually the answer is exercise, diet, and sleep. So for children with hyperactivity, and children across the board. So I hate to kind of just like, it's the child with hyperactive tendencies or with ADHD, right? I don't want to think of that child as that label. It's just a child who also happens to be hyperactive. But these things are going to be important across the board. Exercise in particular. So if we start there, the benefits of exercise and physical activity are endless. So, it improves.
That very, very well.
Right? Exactly. So, and in this case in particular, for a child, like it improves their concentration. It promotes brain growth. And in particular for children with ADHD or attention deficits, exercise itself will actually lead to better sleep. And that's usually, again, how we actually started off this conversation, having like sleep issues in children with ADHD or hyperactivity. So this is one of the things we can implement that are going to have a multitude of effects. It's not just trying to like focus on one complaint, so to speak. So what I encourage is usually, time in nature. It's that green exercise. There's been studies on it with to helping reduce symptoms in children with ADHD. So, 30 minutes a day will do ya. I know it's complicated right now. I'm not sure when everyone out there will see this, but if you're seeing this in the future, think back to the time where we were all in lockdown and we couldn't really be in a lot of green open spaces. So, if you don't have the luxury of having, a backyard or green space around your home, finding a place where you can walk, again, maintaining that social distance, but that you can observe trees, and even like just looking at pictures of nature can be quite soothing. But if we can actually do physical activity outdoors, that's excellent. And in particular, if you're going to ask me, okay, but what kind of exercise? Do I just let them run loose? That's an option. Anytime we're expending energy is great, but in particular for children with hyperactivity, we really try to make that mind-body connection. So things like, taekwondo, karate, yoga, skateboarding, gymnastics, any martial arts.
Building things. I know my kids love to build things. Is building things? Oh.
Yeah, so like if they're like physically active in like getting like big blocks or like boulders, or like in the winter time they're making like snowmen. That's a great way to get them involved. They're using their body, but they're also, using other skill set to build something. There's planning. So there's other cognitive things that are happening that are going to be important. So in terms of exercise, those would be the recommendations to start with. Again, all of this being said, you really need to cater to the child in front of you, right? So this is just very generalized information, but a good point of reference in terms of what's out there in terms of options.
Right. Are there going to be, and this may be very specific to a child, and it may, the answer may change if a child has other factors at play, I guess, in their diagnosis, but are there going to be supplements that a family might be advised to have their child look at taking when looking at sort of the holistic route?
Yes.
Supplements that they might be running into?
Exactly. So in terms of kind of like as we're moving along on those pillars, so like we've done exercise. So in diet, obviously we've discussed the importance of intolerances, sensitivities, and maintaining that diet with less sugar. And this would, again, across the board for all children and for all adults, really. At the end of the day, even though it's yummy, it does us no good.
It's interesting, the sugar conversation. Actually,
yeah.
You had mentioned sugar before. I wanted to share this story. The opportunity just didn't present. But I think sugar is one of those things where families just don't know. And, we've had a conversation with another holistic practitioner that we had on the show before as well. And especially in North America, we grow up in a culture of reward. And you grow up in a culture of, you use the potty, you get a candy. You put your clothes away, you get a chocolate bar, those kinds of things. Sugar is so ingrained in our culture and our society for a reward system.
Yep.
Even for our own selves, right? You see it in the media all the time. Oh, you've had a really hard week. Go out and get a container of that ice cream that they always show on television, right? Like, it's so ingrained. And I think it's one of those things for some people, they just don't know what they don't know.
Yep.
I remember learning about this sort of early. I was in college, so I went through and did my developmental service worker. So I was working with kids who had special needs. And as my job, how I put myself through school, I did lots of different contracts with lots of different families. And I remember working with one family who had a little boy, and to be honest, I forget what his diagnosis was. But I was to come into the house, I think twice a week, and I was helping him with his schoolwork and like his activities of daily living. So putting his clothes away, tidying his rooms, and those kinds of things. And I remember something being off when I first started working with family, and I couldn't figure out what it was. But this kid was bouncing off the walls by the time I got there, let's say 4:30 in the afternoon. And I had worked with the family for probably about 6 weeks. And I came in early the one day. I took transit, so I got there early the one day. And I saw that they were giving this 4-year-old Pepsi. Like, oh, wow, Pepsi. And it was a 2-liter bottle. And the bottle was about halfway finished. And I forget how the conversation came up. But basically, they used a 2-liter bottle of Pepsi every single day to reward the child for behavior. So this child was consuming an entire 2-liter bottle of Pepsi every day for good behaviors, whether at daycare or at home or school. And I came to find out that when I left, if they did a really good job, he got to finish the bottle of pop when I left. And I was like,
Oh boy.
I don't know. I'm not a doctor, but I know that's not it.
Mm-hmm.
So I remember having the conversation with the family of, like, you giving him the large glass of Pepsi before I get there is impacting my ability to be able to work to my best capacity with him. Can we at least just, like, I can't control what they do.
Exactly, yeah.
You just control what you do before I work with the child. And there was no willingness to budge. They were so set on that being an appropriate reward because it got the result they were looking for. And I ended up having to stop working with the family because it was just, I wasn't able to provide the level of service that I wanted to be able to. And I think it goes back to that sugar is such an ingrained reward. Treatment are such an ingrained reward that it is very hard to look past all of those sort of things, I guess, that we do for our kids. But I mean, an outsider looking in, you can see how that impacts all of that, right?
And again, and I have this conversation anytime I discuss diet, it just feels like there is such a defensiveness that comes up because.
But how can it be wrong, Dr. Anna? Telling me on the television,
I know,
telling me in the Facebook post that I saw that I should be rewarding good behavior.
Mm-hmm. And you know, it's true. You should be rewarding good behavior, especially with like children with like hyperactivity. You know, praise is good, but it's just what kind of reward are we offering our child, right? Is it like a sticker? Is it an activity? Is it something that they have wanted, or is it like food, right? So we can choose what type of rewards, and sometimes even like a very genuine, you know, I'm proud of you compliment and a smile and a hug can do a lot for a child rather than just maybe those 2 liters of Coke. And again, it's, you know, you can only offer your best expertise, but it's like you said, you can't control then what happens in the household. It's just you try to provide that information. And the thing is, I'm not a saint by any means. I have a sweet tooth. I'm a self-proclaimed person with a sweet tooth. Like anytime I have downtime, I'm baking. But it's really about that 80-20 rule. And the thing is, if you're dealing with a child or an individual that needs that extra support, by not following through with some of these things, it is detrimental to them. So you're, again, with anything, with any kind of treatment, and diet is a treatment, it's weighing that cost benefit. How willing are you to provide those 2 liters of Coke to your child for that maybe momentary reward versus what you're going to have in terms of consequence? So for me, it's not equal. Like, I'd rather risk having them upset at me and dealing with other things than providing them that Coke, knowing the other consequences on the other side. So diet is huge. And I know you asked me about like supplements, and I started discussing diet beforehand because some of the supplements that we do take into account with children with ADHD are things such as like zinc, magnesium, iron, and vitamin D. Those are the ones that you'll find a lot of research in terms of notoriously children with ADHD having lower levels. So sometimes, obviously, I always like to do things through food first, especially when we're talking about children. But if you're, you know, maybe at a level that we need to supplement for a temporary period of time to get you within range, or to see if it will or won't have benefits for you, that those are appropriate, and it's something that you'll see often within the realm of children with ADHD. But then also other supplements have been tested with relatively good results. B vitamins being one, that's some research is linking symptom severity to B vitamin deficiencies. Things like omega-3, probiotics are also usually in our toolkit. And again, for other underlying uses, so to speak. So getting to that root cause, so working on brain development, brain function, but also, again, catering to gut health, and because of that impact. So they're not necessarily things that we use to treat by any means, but to manage symptoms and to help improve whatever baseline issues that are present in that child. So again, supplementation will definitely have a role. It might not be appropriate for every child, and you'll really have to cater it to their individual needs. And depending on what their diet is, you might see that they might have some nutritional deficiencies, or they may not.
Right. So speaking of supplementation specifically, one of the ones that I keep hearing from friends, and I'm not sure, I guess the safety aspect of it, is melatonin for sleep. Is melatonin safe for kids to be taking with ADHD or hyperactivity disorder of some kind, especially if sleep is being impacted?
Mm-hmm. So you can dose now like melatonin. Usually, like for adults, it starts at 3 milligrams, and I'm not advising anyone to take that amount. It's just like what's
this
out
is
there.
Just in general information.
Yes, exactly. But even if we want to microdose it, there are little droppers that will have doses that would be appropriate for a child, because we always, whenever we're trying to prescribe or supplement a child, it has to be in accordance, with their age, but also their stature. So if they're like very thin and short, it's going to be different from a child that's very tall and has like some more weight in comparison to another child. So it could be one of the strategies when we're looking at sleep in particular. The thing with melatonin, it depends on the amount you're taking, but it does have other side effects. And one of those side effects is kind of like night terrors and things of that nature. Now, those are usually in higher doses, but again, a child at a smaller dose might experience some of those symptoms. Some will complain of grogginess in the morning, which can be difficult for any of us to get out of bed if we're not feeling kind of alert. But again, it's one of those things, and you'll see it in adults and children across the board. It's very much trial and error. You'll find patients, regardless of their age, that'll do very well on a supplement like melatonin, and others that'll either not have the effect they want or will have side effects that they're not necessarily liking. So what I usually advise when we start with sleep, unless there is just a major issue with sleep where the child is not getting any sleep, and then that's a different conversation. But usually implementing sleep hygiene strategies is a good place to start, because if we're using our screens right before bed, maybe we've drank those 2 liters of cola, maybe we've been out running around in the evening and you're feeling a bit more wound up. If there's light in your room, if you're not getting enough exercise, all these things will then impact your ability to sleep and get a restful night's sleep at that time for your child. So usually we have to do a bit of that legwork before just relying on a supplement and negating everything else. And that can be hard. Again, it's one of those things. Sometimes we need to bridge that while we put in the work to give us some relief, and the child needs to sleep, right? They need to recover and be able to function the next day. But relying just on one supplement to treat one thing can be problematic down the road if we're not doing the rest of the work. So it's not incorrect, but we also need to make sure that we're doing the rest of the work as well.
Well, as parents, sometimes we want that quick fix also, right?
Yeah.
Results right away sometimes. But I think that's why it's important to have professionals and practitioners like yourself, because, man, I think we are starting to see like so many more people are being aware the body is so complicated. Everything is so different. Our insides react so differently to different supplementation, medication, all those kinds of things. That's why it's so important to have practitioners like yourself available and help us to look at the whole picture and really get that customized solution for this body right here.
Exactly. Yeah. And it's as you said, you both, obviously the parent, the caregiver, but the child, right? They want to. And again, it goes back to that reward system, right? If they're putting in all this effort to change behaviors, to maybe eat certain things or not eat certain things, and then they're still not feeling good, it can be really difficult to keep at it until you start seeing some of those results, right? So you need that buy-in. sometimes you do need that supplementation, you need that help, and sometimes your body needs that extra oomph.
Right.
Until you really have things in order to the best of your ability, right? But you have those lifestyle habits in place. And so that's when it becomes appropriate. And like you said, it has to be catered to that individual in front of you. And
right.
like I've said, sometimes, yes, even though naturopathic medicine, we don't really talk about standards of care. There is no one way to do anything, but you'll find after seeing a lot of patients, there is a rough guideline. If you come in and present with, ADHD, there's going to be a semblance of dietary suggestions, exercise suggestions, sleep suggestions, that are going to be the common thread through a large majority of patients. But then it's those details of what works for that family, what works for that child, or what supplementation is appropriate for the needs of that child. Maybe they also have underlying anxiety. So maybe you might need to provide a herbal medication, not medication, but a herbal supplement that will help with those symptoms. So it's evaluating the person that's in front of you and not just kind of one idea fits all type of approach.
Right. This was fantastic. There's so many good little nuggets in here for parents to consider, regardless of whether your child has it. I'm certain you will run into some family along the way who has a child who has some level of hyperactivity. So these little nuggets are great for people. So we always like to end the show with 2 things you would like families to remember. So let's pretend that they're just tuning in at the end and they didn't get all of those other amazing nuggets that you talked about, which you're going to go back and watch the whole episode.
Yes. Take notes.
Just in case for now, what would 2 things you would like families to remember or consider with a hyperactive child? What would those 2 things be? Whether it's their child, someone else's child, what are 2 things we'd like to leave with families today?
So this first thing, I'm going to try to wrap it up in one very long sentence. So I'm trying to cram in all the information. Yes. So a child is not reduced to a label. So whatever that label may or may not be, your child is much more than that. And so when we're talking to hyperactivity in general, I understand it's a challenge, but there's hope. There are support systems out there, and people such as myself, like naturopathic doctors, that can provide some of that support so you're not alone. And never forget those 3 pillars: sleep, diet, and exercise will guide you down that right path. So small steps. And then number 2 is, in this conversation, especially because we're talking about family dynamics and something that can be quite difficult for parents or caregivers to deal with, is don't forget about yourselves. So you can't, again, like we say, you can't pour from an empty cup. So be sure to check in with yourself at the end of the day. Get the support that you need also to be there, present and able to best support your child.
Beautiful. Awesome. One thing I think I would like people to consider with this at the end as well, and it goes beautifully into your first point of them not being a label. Please, you need to understand, especially with hyperactivity disorder, it is not even about the label. It's about, for every child, harnessing that power. And in a positive note to finish the show, some of the biggest entrepreneurs in today's world have hyperactivity disorder. They just work with proper professionals to help them live with it and empower themselves to work with it. So I love that you put that point in there, because throughout the whole chat, I really just wanted people to know there is absolute power with this also, especially as you get to be an adult. And some of the biggest entrepreneurs we know today, if you do research about them, they have hyperactivity or ADHD themselves.
It goes back to that little comment that I made, that these children, they have so much creativity to offer.
Right.
Right. And usually, and the thing is that I don't think I mentioned this, usually they do really well at the things that they like. If you put a task in front of them that they like, you're golden. If it's boring and repetitive, such as some of the schoolwork is, right?
Yep.
And we've all been through that. We've kind of had to fight through doing something, then, it's game over. And so much like you said, Jennifer, it's harnessing that brilliance that most
Their
of us can't.
superpowers.
Yeah, we can't tap into some of, if we're too in the box, usually we can't tap into that creative mindset that these children are kind of gifted with. Right. So it's try not to shut it down. It's managing the less positive side effects or consequences, and then working with the gold.
Right. Woo, that was great. That was an way to end this episode. Thank you, Dr. Ana.
You're very welcome.
If you love this episode, if you have any questions for Dr. Ana, we're going to put her contact information in all of these episodes as well. She has a practice, and I'm sure she would love to hear from you.
Yes, I would.
She will be back. We have so many awesome topics to bring you Dr. Ana's knowledge and information from. So stay tuned. She will be back for more episodes. Thank you again, Dr. Ana, and we'll see you.
Thank you, Jennifer. Bye, everyone.
Salsa